All right, ready to dive into something a little different today. We're talking oral and maxillofacial surgery.
Oh yeah, this should be fun. A lot of people, they hear dentistry and their eyes glaze over. But trust me, this is a whole other ballgame.
Right. We're talking way beyond just routine checkups and fillings, aren't we?
Absolutely. This is serious stuff. Think impacted wisdom teeth, facial reconstruction after trauma, even dealing with tumors. This specialty blends medicine and surgery in a way that's really unique.
Okay, so before we get into the really wild stuff, let's lay some groundwork. What are
Yeah.
some of the core principles that guide oral and maxillofacial surgeons? I mean, this is a pretty delicate area of the body they're working with, right?
It is, definitely. And that's why patient safety is like the absolute top priority. I mean, we're talking about procedures that can, really impact a person's appearance, how they speak, even how they breathe, minimizing risks, making sure we get the best possible outcomes for each patient. That's huge.
Makes sense. And obviously, you can't mess around with infection control in this area. Aseptic technique must be super important.
Oh, absolutely. Maintaining a sterile field, that's non-negotiable. It's all about preventing those post-op complications. So we're talking strict sterilization protocols, proper disinfection, you name it.
So let's talk about something that I think everyone who's ever been to the dentist has wondered about. Anesthesia.
Mm-hmm.
Are we talking about being completely knocked out for every procedure? What are the options here?
Uh-huh. That's a great question. It really depends on a few things. What the procedure is, the patient's medical history, how anxious they are, things like that. We don't always knock people out. For
Mhm.
simple things like, say, a basic tooth extraction, local anesthesia often does the trick.
So just numbing the area.
Yeah, exactly. Patients awake, but they don't feel a thing around the site. Sometimes we might use a little nitrous oxide too, laughing gas, just to take the edge off.
Oh, right, the good old lapsing gas. And then for more intense stuff.
That's where conscious sedation comes in. Basically, we give some medication through an IV. It really relaxes the patient, reduces anxiety. They're still awake and can respond to us, but they probably won't remember much, if anything, afterward.
Like a nice little nap?
Kind of, yeah. But then, of course, for major things like, say, jaw reconstruction, or if we're removing a tumor, that's when we go for general anesthesia.
Got it. So the big knockout. All right, well, let's talk about some of the bread and butter procedures here. I feel like most people, when they think of oral surgery, they think tooth extractions.
True, true. And while general dentists do handle simple extractions, we get called in for the more complex cases, like those dreaded impacted wisdom teeth.
Oh, yeah, the wisdom teeth. Why are those such a pain, literally?
Well, think about it. They're the last teeth to come in, and often there's just not enough room for them. So they get stuck, impacted below the gum line, maybe only partially erupt, and that leads to pain, sometimes infection, and it can even damage the surrounding teeth.
So it's not just about getting rid of a tooth that's bugging you, it's about preventing bigger problems down the road.
Exactly. And getting those impacted wisdom teeth out, it usually requires a surgical approach. Incision in the gum. Sometimes we even have to break the tooth up into smaller pieces to get it out. It can be pretty involved.
Wow, okay, so not your average tooth pulling. But let's move past teeth for a moment. I know oral surgeons also deal with facial trauma. What kind of injuries are we talking about? How do you approach treating those?
Oh, it runs the gamut. Everything from car accidents and falls to, unfortunately, violence, simple cuts and bruises, all the way to like serious breaks in the facial bones.
I can imagine that must be pretty
It
intense.
can be. The goal is always to restore both form and function. We want the patient to breathe properly, eat properly, speak properly, and of course, we want to minimize any kind of, lasting disfigurement.
So you're like facial reconstructive artists almost.
Kind of, yeah. Lots of plates and screws and wires to put things back together. Sometimes we have to do soft tissue reconstruction too, muscles, nerves, skin.
Yeah, I imagine these injuries can be really traumatic for people, not just physically, but emotionally.
Absolutely. Having a facial injury, it can really shake someone's confidence. So we make sure to provide support, not just for the physical healing, but for the emotional healing as well. It all goes hand in hand.
Right, that makes a lot of sense. Now, let's switch gears a bit. What about those growths that can happen in the mouth and jaw? What kinds of things are we talking about, and when do you decide they need to come out?
Right. So you can get all sorts of growths from simple cysts, which are basically fluid-filled sacs, to tumors, which are more abnormal cell growths. And tumors can be benign or, unfortunately, malignant, cancerous.
I see. So how do you figure out what you're dealing with?
We'll start with a clinical exam, of course. And then usually some imaging, like X-rays or a CT scan. If we suspect a tumor, we'll take a biopsy, just a small tissue sample to look at under the microscope. That's how we tell if it's cancerous and decide on the best way to treat it.
So if it is cancerous, what happens then?
It all depends on the type of cancer and how far along it is. We might surgically remove the tumor and then maybe follow up with radiation or chemo. It's really a team effort working with oncologists and other specialists to make sure the patient gets the best possible care.
Makes sense. Now, I know we've only just scratched the surface of what you guys do. What are some other conditions that fall under the oral and maxillofacial surgery umbrella?
Oh, so many. Temporomandibular joint disorders or TMJ, problems with the jaw joint, salivary gland diseases, infections, facial nerve disorders, the list goes on.
Oh, right, TMJ. I've heard of that. What exactly is that? What are some of the symptoms?
So the TMJ, it's that hinge that connects your jaw to your skull. And when it's not working right, it can cause all sorts of problems. Pain, clicking, popping, trouble opening or closing your mouth can be pretty debilitating.
Ouch, I can imagine. And what about salivary gland diseases?
Those are the glands that produce saliva, important for digestion and keeping your mouth moist. They can have problems too, stones, infections, sometimes even tumors.
Oh, right. And infections, that's more than just a regular toothache, right?
Yeah, in this area, infections can get serious pretty quickly. They can spread to nearby tissues, even get into the bloodstream if you don't treat them fast.
Yikes. And last but not least, what about those facial nerve disorders you mentioned? What kind of impact can those have?
Well, the facial nerve, it controls all those muscles that let you make expressions. So damage to that nerve, it can cause paralysis, weakness, twitching, really affect a person's appearance and their ability to communicate.
That's incredible. I mean, it's really amazing how much this specialty covers. It's like a whole world unto itself.
It is. And we haven't even touched on things like pre-prosthetic surgery,
Yeah.
getting the mouth ready for dentures or implants or orthognathic surgery, where we actually realign the jaw bones.
See, I told you, this is a deep dive.
Absolutely. There's a lot more to uncover.
We'll definitely have to say that for next time. Join us for part 2, where we'll dig into those specialized areas and explore some of the cutting-edge advancements that are shaping the future of oral and maxillofacial surgery.
Welcome back. Ready to jump back into the world of oral and maxillofacial surgery?
You bet. Last time we left off talking about pre-prosthetic surgery and orthognathic surgery.
Mhm.
What exactly does that first one, pre-prosthetic surgery, what does that involve?
So pre-prosthetic surgery, it's all about setting the stage for dentures or implants, making sure the mouth is, well, the best possible environment for them. Sometimes that means smoothing out bony ridges or maybe building up the jawbone with grafts. It's about creating a solid base for the prosthetic so it fits well and functions properly.
So it's not just a matter of, like, yanking a tooth and popping in a denture. There's more to it.
Right, especially if there's been bone loss. We need to make sure there's enough structure there for the prosthetic to, really sit securely and do its job.
That makes sense. Now, speaking of implants, those have gotten so popular, haven't they? What makes them such a good option compared to those traditional dentures?
Oh, implants have a lot going for them. First off, they're tough, durable. They're usually made of titanium, which is great because it actually fuses with the jawbone. It basically becomes part of you.
Wow, so it's like having an artificial tooth root.
You got it. And since they're anchored right to the bone, they're way more stable than dentures. No more slipping and sliding around. Plus, you get much better chewing power.
Right, and I bet that stability also helps to keep the jawbone itself healthier.
Yeah.
Prevents that bone loss you mentioned earlier.
Exactly. With dentures, the bone underneath can start to shrink over time, which can change your facial structure and even make it harder to wear the dentures comfortably. But implants, they actually stimulate the bone, keep it strong and healthy.
Interesting. So there are, like, different types of implants, right?
Huh?
And different ways to put them in. What can you tell us about the options?
Sure. The most common type are endosteal implants. Those go right into the jawbone. Then you have superiosteal implants. Those sit on top of the jawbone, under the gum tissue. Those are usually for when there's just not enough bone height for the other kind.
Got it. And as far as putting them in, the procedures, are there different approaches there too?
Oh, yeah. Sometimes we can put an implant in right after we take a tooth out. Other times we have to let that extraction site heal up first. And sometimes if there's a lot of bone loss, we might need to do a bone graft before we can even put the implant in.
So it's all about finding the right solution for each person's situation. No one-size-fits-all approach.
Exactly. And technology is playing a bigger and bigger role too. Computer-guided implant surgery. We use 3D imaging and software to plan out exactly where those implants are going to go.
Yeah.
Super precise.
Wow, that's incredible. And it sounds like implantology is constantly evolving.